Payman Simoni. I'm a dual board certified facial plastic surgeon. I would like to talk about rhinoplasty today, which is commonly known as nose job. Rhinoplasty is the most difficult plastic surgery procedures. There are three groups of surgeons who are formally trained in their training program to perform rhinoplasty. One of these groups are otolaryngologists, or commonly known as ear, nose, and throat surgeons. As an otolaryngologist, a surgeon is being trained very well for the breathing aspects of the nose, which is the septum, sinuses, and turbinates within the nose. However, depends on where an otolaryngologist has been trained. There is a difference on how much of the cosmetic aspects of the nose has been taught. Some otolaryngologists, they get a lot of training on the cosmetic aspects of the nose, and some people less, and that depends and varies between the surgeons. The second group of surgeons who performed and formally trained to perform rhinoplasty are general plastic surgeons. As a general plastic surgeon, and this is the commonly people think about when they talk about a nose job, they talk about a plastic surgeon. As a general plastic surgeon usually they get training within the general surgery, which is everything below the neck, and after 5 years of general surgery, they do plastic surgery fellowship. Within that plastic surgery fellowship, a surgeon has to be exposed to many aspects of the plastic surgery, which are hand surgery, microvascular surgery, burn, trauma, abdominal surgeries, which is like a tummy tuck, breast surgery, liposuction, face, eyes, and nose becomes one part of it. Unfortunately, the amount of training a lot of plastic surgeons they get during their training program might not be adequate for a surgeon to perform rhinoplasty when they finish their training program, and the amount of exposure is usually limited. That explains why there are so many bad nose jobs out there. It takes a few years for a plastic surgeon to get enough experience to perform a good rhinoplasty. As I mentioned, this is the most difficult plastic surgery it is. The third group of surgeons who perform rhinoplasty are facial plastic surgeons. As a facial plastic surgeon, majority of them, they are trained. First they do general surgery. After that, a facial plastic surgeon does head and neck surgery and otolaryngology, which we explained before. And after that, they do additional training in facial plastic surgery. A facial plastic surgeon usually devoted most of the training to the nose and the face, and that is why by some people they are called a nose or face specialist. We are the one who do majority of revision rhinoplasty, which we will discuss in another session, which is even more difficult than the primary rhinoplasty, because those majority of them include breathing problem, and they are more difficult cases than just a primary bread and butter of the rhinoplasty. However, there are other surgeons who perform rhinoplasty, and they are not formally trained in a training program, and believe it or not, they could be a variety of the surgeons, such as OBGYNs, they can be even a dentist who perform rhinoplasty. A lot of patients, by going to those surgeons, they would not know what is the main specialty of those surgeons unless they ask. Usually the recommendation is, if you want a facial plastic or a plastic surgeon to perform rhinoplasty on our nose, you're looking at board certified plastic or board certified facial plastic surgeon. Now let's go back why rhinoplasty is the most difficult plastic surgery it is. One reason is that you cannot keep doing the procedure. Usually rhinoplasty should be done correctly at the first time. If somebody does the rhinoplasty multiple times, or a surgeon thinks about doing a procedure and later on maybe touch it up, this is not the way to go. Most of the cases that revision occurs, the results are unpredictable, are not as good as it should be. So rhinoplasty has to be done on once only. The second reason why rhinoplasty is the most difficult plastic surgery is because it's three-dimensional. Once you change one aspect of the nose, other changes. Just like that cubic puzzles, that once you change something, the other parts start changing. So With the rhinoplasty, a surgeon has a good understanding of the anatomy of the nose and all the way the cartilages sit in the nose and variety of different noses, and every nose is different. And the surgeon has to understand, while changing one aspect of the nose, how the other part of the nose changes. The third reason why rhinoplasty is the most difficult plastic surgery is that it has to match a person's face. A good nose on somebody might not look as good on somebody else. When it comes to rhinoplasty, a surgeon not only have to have a skill to perform a nice nose, they have to perform a natural nose. What the natural means? Natural does not mean unperfect nose. Natural does not mean a nose that is not done properly, that it should look natural. No, a natural nose means the perfect, but the perfect for the person's face. Every face is different, so as every nose has to be. So what I have always tried in my patients is that analyze the face, look at the face, and trying to match the nose based on the patient's face, even the height and the ethnicity of the patient. So that looks natural. A nose is not a beautiful object on the face. However, it sits right in the middle of our face, and that's something that we always pay attention to when we look at somebody else. What we like to achieve with rhinoplasty is to take the nose out of its equation, meaning that when we look at someone, look at the areas of the face which is known for the beauty, which is eyes, eyebrows, cheeks, and lips. If you go to any cosmetic stores, you'll see that there's tons of materials for eyes and eyebrows and the cheeks and lips. There's not even one product for the nose, because nose is not supposed to be enhanced. Nose is supposed to be de-enhanced, means removed from that equation. When we do a rhinoplasty, we have to do it in a way that when you look at the person, the nose doesn't exist, meaning that you start looking at the eyes and the cheeks and lips and other areas of the face. However, if somebody performs a rhinoplasty, and even if it's a good nose, in that person, if the nose looks done, it looks surgically altered, it will take the attention to it, and it defeats the purpose of performing rhinoplasty in the first place. So what I like to achieve in a patient, and to me that's what a natural rhinoplasty means, is that to match that nose to the person's face and trying to create a harmony and balance. And the beauty is the harmony and balance. The last thing that I'd like to talk about rhinoplasty is that the rhinoplasty should not be a very aggressive procedure. It should be done very delicately, and that makes a difference between surgeon to surgeon. Surgeons have to be delicate when it comes to the rhinoplasty, because a good nose and a bad nose, the difference are millimeters, not centimeters. It's not like a breast implant that you can be off by a centimeter or two and you will be okay. No, you have to be exact by the millimeter. There are two things I personally do differently than other surgeons. I do not break the nose, and a lot of patients ask me, do you have to break the nose? And I tell them, no, I do not have to break the nose. The other thing that I do differently is I do not pack the nose. For people who don't know what a packing is a gauze that we insert inside the nose after the surgery, and in a few days after it gets pulled out. Sometimes it's extremely painful. I have seen people passed out from the pain when the packing was removed. What I have done is that I have changed and modified my procedure so I don't have to break the nose and I don't have to pack the nose. While I don't break the nose and I don't pack the nose, as a result, patients are not as swollen, they look more natural, and they don't get as much as black and blue, and they do not need pain medication. Majority of my patients, they tell me that after the procedure they did not have to take any pain medication, and just a Tylenol sufficed it. So this is not a painful procedure. It's a person after 7 days, they should feel that they can go back to society without looking done, and people notice that they have a rhinoplasty done, and if it's done correctly, it's not a painful procedure.